So our case is on Sarah Smith. I'm Rachel.
I'm Amani.
I'm Sarah.
I'm Lydia.
So Sarah is an 18-year-old Caucasian female. She has attempted suicide twice in the past 6 months and has been sexually abused as a child by her grandfather. She has medication for her anxiety and depression and is moving from high school to college. So she's binge drinking with her roommates and engaging in risky sexual behavior. And her mother is worried that she cannot make rational decisions on her own. So the question that we pose is, what is the best intervention for risky sexual behavior?
Okay, so some of the keywords we chose were risky sexual behavior, intervention for risky sexual behavior, risky sex, and CBT. Some of the parameters are, all articles were from 10 years and up. They were either case studies and they were full text. Some of the databases that we decided to use were Google, SPSU database through the library. So they had ProQuest, EBSCO, and PubMed.
All right, so the analysis of Sarah's case. So the search term that we used to look up some interventions that could help with this risky sexual behavior is college students, anxiety and depression, risky sexual behavior, and sexual abuse trauma. We decided as a group the best form of the treatment priority is risky sexual behavior because it's detrimental to her self-image and it could be life-threatening. She was sexually abused when she was younger, so this could be a result of that trauma never being fully dealt with. That could be now coming out and creating problems for her now that she's starting her adult life. We feel depression and anxiety are very important, but engaging in risky sexual behavior could be that result from that past experience and that she just never actually fully 100% dealt with it.
So the studies that we found, all of the articles that we found were empirical. Like Amani said, they were from 2009 or up. All of the studies that we used had methods and discussions, and what they did was they focused on participants and different interventions that they were dealing with when they were dealing with risky sexual behavior or sexual behavior, and it looked for what worked best towards educating them and making sure that they were making the right decisions, especially among teenagers like Sarah is. So risky sexual behavior can be predicted from other events going on in someone's life. So for example, if someone's dealing with domestic abuse along with having depression, it can lead to risky sexual behavior. So it's kind of something that stems from other bad problems, and in Sarah's case, the trauma of sexual abuse and depression and anxiety, that now that she's in college and she's drinking with her roommates, it all kind of correlates to her having risky sexual behavior, and it forms to the issues that she's dealing with. So the most common interventions that we found among our articles are education and cognitive behavior therapy. Education is important because it can put Sarah in a group setting, and it teaches her about sex in general. It teaches her about contraceptives and the consequences of her actions. It helps her because it puts her in a setting that she can be open and honest with questions, and she can ask things that her peers might not know, or her friends or roommates might not know, but the teacher or other people involved in that class might have the same questions, and it can be answered, and she can become knowledgeable on that subject. Also, it brings an open and honest environment, so she hopefully won't be as timid to have conversations with her future sexual partners because it becomes more of a norm in her life. And the other intervention was cognitive behavior therapy. And there's different types of therapy. You can do group therapy, individual therapy, family therapy, or have support groups. And the same reasonings kind of go towards that, but in a little bit stronger way. She has a setting that she can talk with someone one-on-one and ask questions and talk about her past and figure out how to deal with it and prevent those things from happening in the future. She can learn about what the right way to do things and have sex is without it being risky, and then hopefully by solving this risky sexual behavior, it is a way that she can get that under control, and then she can start focusing on the other things like depression, anxiety, or other college stressors that she's having in life.
All right, so the possible interventions that we came up with. So the two that we had come up with was 4. One is the comprehensive abstinence sexual education class, which is just like a sex ed class, and it teaches you personally, like Sarah was saying, like one-on-one goals. You can actually learn how to use contraceptives safely, and of course teaching that abstinence is 100% the best way to go to avoid STIs and unplanned pregnancy. And it's the most morally acceptable youth option for youth. Also, therapy was the other one we thought of as well, so individual or group therapy. Family therapy can help resolve conflicts with the family and also help express personal concerns. It can help with creating better communication, and they're also helping them deal with the other sexual issues as well. There's also support groups. So we thought that like a support group would be a little bit more better and beneficial because it's a major benefit is from the group therapy is validation. By being in a group with a number of people struggling with the same problem, you can see that you're not alone with your struggles. In addition, you may learn that some people in the group are having a hard time coping with the same difficulties. So it can help create a special relationship and bond that you can create and build on future relationships for. So it actually helps them actually have a relationship. Okay, let's go. And with that as well, with individual therapy, you can get like one-on-one group time, and that can also help. But that can mostly just help not only with her sexual trauma, it can help with her depression and her anxiety because she can talk to one person and focus on one person to help her get everything that she needs in order in a safe place. She feels safe, but in the group setting, she can express all of her concerns with the sexual trauma that she had, and then other people can relate to that as well.
Okay, so another intervention that we talked about was the SSB and RMAS. So the SSB stands for Safe Sex Building, and RMS stands for Real Men Are Safe. So the SSB focus more on females, and the RMS focus more on males. So they each comprise of a 5 90-minute sessions where participants are taught to sexual HIV transmission, high-risk sexual activities are identified, and the use of safe sex practice is highlighted to protect them and one's partners. Participants discuss concerns about the use of safe sex practices, and participants in exercise to improve their negotiation skills with their partner and prospective partners. So the RMAS teaches the use of assertive communication and active listening skills, and emphasize taking responsibility for protecting selves and partners. SSB stress balance between meeting relationship needs and practicing safe sex behaviors. Participants in SSB brainstorm and rehearse strategies for refusing risky sex while avoiding harm for potential aggressive partners. The women intervention is orientated to communicate and assertiveness and relationship skills. And so Dr. Tross was one of the doctors that did the intervention. And so he was saying the reason why they focus more on women because women haven't had much power over sex and a relationship compared to men. So in a large-scale test of gender-specific intervention, male participants in the Real Men Are Safe and female participants in a safe sex skills building workshop made greater reduction in high-risk sexual behavior for long periods than comparison groups who were just provided a standardized single sex education course. And so the next treatment is CBT. So CBT are treatments that are based firmly on research findings. So they approach aids people in achieving specific changes or goals. So the therapist helps survivors to understand their memories through conducting therapy. This reduces the emotional impact of memories, and eventually the intrusive thoughts, flashbacks, and nightmares disappear. Although memories will not be pleasant, they can reduce the psychological pain and anxiety. The therapist tries to reduce the guilt and fear related to the survivor's sexual abuse response, and the therapist helps the survivor to reduce the symptoms of PTSD through techniques like relaxation training. The therapist can also lessen the flashback or triggers by relieving and re-experiencing the victim. The psychologist may also give the patient certain techniques such as anger control, assertiveness, training, and speech, depending on what the person needs.
All right, so our ending goals for Sarah are safer sex practices. And that is just reminding her that she needs to, if she wants to have sex, then she should be thinking about different risk factors, which is STDs, unwanted or unplanned pregnancy. And then also thinking about, depending on that partner or multiple partners, if she would want to deal with them or be with them for a long period of time, and if not, thinking about safer ways to go about having sex without having any other factors after that, if she wants to cut off all communication with that person. We also want to work through her past sexual abuse trauma, so making sure she doesn't feel any shame about what happened to her, and just helping her understand that it is something that happened to her and it wasn't her fault, so that she is able to have sex if she wants to and feel liberated with her body, because it is her body and her choice on what she wants to do with it. We also want to continue to give her resources for safer sex practices. So using the contraceptive approach, instead of just telling her no, this gives her more options. So again, with that thought in mind that we want to liberate her and give her the freedom to choose what she wants to do with her body, just adding in the fact that she should do it safely so that she can enjoy everything that she wants to enjoy with her life and her body. And then continuing resources for group therapy. So allowing her to open up with a group of people that are her same age, so she feels comfortable. So this allows her to, like Rachel said, continue to have a safe environment to talk about things with, and then she's also able to see that it's not just her. So there's other people that are dealing with the same thing, and that she doesn't have to feel ashamed about anything that she's doing at all. And then lastly, we want to continue or suggest family therapy. This will allow her to be united with her family and her parents, so that they all understand that it's not any one of their faults, and it's not just pinned on one person except for the abuser. And this helps unify them so that they're able to talk through their problems, and that Sarah won't have to feel so alone, so that if she wants to open up to her parents about any experiences she's having in college, she's able to do that without feeling like they'll judge her. So it just creates a more safe environment for her and her parents. And that's what we want to continue with Sarah, and that's what we would also suggest. Do we have any questions? And if you do, we're more than happy to comment.
And one last thing, the RAIN organization, they focus on working with women that are been sexually assaulted. So if you want more information, or if you have a family member who's been involved with that, please check out rain.org, because they have facilities, group therapy, group chats, pretty much anything that will help you if you need help as well.
We're just hoping overall that like therapy is just a start. It's a start to chip away for her risky sexual behavior, and like Lydia said, don't tell her no, because a lot of people might just say that's wrong, like don't have sex and you'll be fine. Like that's not realistic. So giving her the resources that she needs is important, and starting with the risky sexual behavior is just the beginning. Therapy can continue on in her life. It's not a permanent thing, but starting off with risky sexual behavior is important to get this taken care of and under control, so that she does not have to fear the consequences that could come from it. And then therefore further on in therapy, if she has a therapist or a support group that she trusts, she can work on her depression or anxiety or anything like that. And as I said, like opening up to her parents or even her friends about it, and maybe educating the other people around her as well, like her roommates, how she's drinking with them. Like it can be a topic if she trusts them to open up with about them. So that's kind of why we picked that, and that's why we thought it was the best intervention for Sarah to start off with and go with towards bettering her life and dealing with the abuse and trauma that she has been through. So.
Great, yep, we just want to start with the one and then she can focus on the other two after that. She feels better with that situation.
Thank you.
Thank you.
Thank